First, I want to thank Gabe and James for inviting me to speak today and be part of the microbiome conversation as it relates to all of our patients' health. Also, I feel it's important that we note the date. Today is October 5th, and I'm a big fan. If you're going to quote me, then date me also, because what I say today, probably in a year or two, will probably be all wrong. And we're going to talk about microbes, and there are good microbes and there are bad microbes. My feeling is, the reality is that it's really the body's or the person's choice or ability to resist these microbes by living a healthy life and being strong. I don't think microbes just come out of the closet one day and attack you. I think they're with us all the time. So our goal in the next few years is really to teach our patients to grow and be healthy, like you did with our children today. I think it was a great presentation. Thank you very much. So we're going to be talking about the oral systemic link. You can't separate the oral systemic link from the microbiome. The microbiome is basically in the mouth, and the oral systemic link talks about how the microbes in the mouth affect distal parts of the body, whether it's the heart, pancreas for diabetes, the brain for Alzheimer's disease. So the oral systemic link is the microbiome. The oral systemic link is the driving force of how to bridge the gap between medicine and dentistry. Names like Weston Price, Royal Lee, Charles Mayo are the early pioneers of the oral systemic link. They are the ones who knew there was something causing hidden inflammation. Today, with new technologies to identify pathogens like DNA testing and the further understanding of the microbiome, these pioneers have passed the torch onto all of us to continue educating ourselves as the community of the detrimental effects of systemic inflammation and the benefits we can derive from understanding of the microbiome. However, today I am proposing that we take hidden out of the phrase hidden inflammation. The game of hide and seek is over. The technology available to us proves it. It's also my wish that with the science behind the microbiome, we embrace dentistry and medicine as a team to better serve our patients and fight systemic inflammation. Now, normally we have a whole conversation about what I call the oral inflammatory triangle. We only have 15 minutes or so today, so we're just going to discuss how the pathogens in the mouth affect distal parts of the body. And we still have a lot to learn about the microbiome. The way I understand it, we can destroy the microbiome with such things as chemotherapy and antibiotics. And we build up the microbiome with pre and probiotics, and we allow it to thrive by creating a healthy systemic environment in which the microbes are balanced by our body's innate wisdom to heal. It is when this balance is affected do we start to see disease. Today we're going to touch on what I call sustainable dentistry, and we're going to briefly go over the dental ecosystem, the mouth as a barometer for overall wellness, and the future of salivary diagnostics. So there are benefits to the microbiome. So in the mouth there is specific bacteria that break down nitrates to nitrites, and that's how we produce nitric oxide, which is used in one way to protect our heart. The rub on this whole thing is where there's now research showing that by doing strong oral mouth rinses, we're killing off those bacteria that create this nitric oxide. So in essence, a mouth rinse can be giving us a heart disease. The question I have, and which we're looking into now, is are these specific herbal mouth rinses, which are from the earth, are they only going to attack the bad bacteria and leave their friends alone? Also, the way the microbiome is a friend of ours is by introducing Streptococcus salivarius. You can actually minimize the possibility of your kids having strep throat or otitis media. So this is where we have a balance of different microbes helping each other. The earth has an ecosystem, the human body has an ecosystem, and the mouth has its own ecosystem. It's my belief we are all governed by the same laws of nature that govern the tree. We resemble the tree with our intestines like its roots and our teeth like its leaves. What I see is that both the leaves and our teeth act as a barometer for their overall health and wellness. So when a patient comes into the office and I see that they're breaking down, I can have them open the mouth and take a look. I can't have them open up their intestines and see what's happening. So the mouth is your first guide that there is something going on with your patients. And we'll touch more on that a little later on too. Oh, one point I wanted to say. It's the microbes that are important for the soil of a tree. So just giving the tree nutrients and ignoring the microbes isn't going to help the tree thrive. And the same thing with us. And this study just shows that we're no longer looking clinically at the mouth for bleeding gums. Now we need to look at the bacteria in the mouth because the bacteria produce inflammatory cytokines. And that's the future of dentistry and medicine. This study just shows, again, how the oral cavity affects distal parts of the body. So they found these are pretty much many of the aggressive pathogens in the gums, and they found these bugs in different atheromas and plaques in patients who had heart disease and heart surgery. Porphyromonas gingivalis is very invasive, but it's also highly intelligent. It actually can increase inflammation, and it also causes dysbiosis by affecting cell membranes. So it's no longer a question, is there an association between heart disease and gum disease? The research has showed it, and when they talk level A evidence, that's the strongest evidence you can have. So I think what separates us from the allopathic medicine model is that they look at signs and symptoms, disease, and dysfunction. Where I think the common thread that ties us together is we look for the dysfunction, disease, which causes signs and symptoms. So where an allopath will look for a high blood pressure causing a stroke and the dysfunction is they can't talk or they're in a wheelchair, we act like detectives. And we're always looking, well, what's causing that problem? What's the dysfunction going on before we get to disease and signs and symptoms? So what we need to understand is that if someone has a heart attack tomorrow, it didn't occur today, it didn't happen today. So we're all sitting out here in the audience, and we have some dysfunction going on that needs to be addressed and identified. And that's where we all come in as detectives. So this is something that I found, and it was really a macro model for me of this whole dysfunction, disease, and signs and symptoms. And it was interesting because it compares the allopathic model to what we did. And I'm a dentist, so you're going to have to see teeth, okay? That's just the way it is. But what's interesting is if you look over here, you see bone, right, dentist? And the patient's chief complaint was he had pus coming out of his chin for about 4 years. And he didn't know what it was. He would wear a beard like James's to cover it up. But it wasn't James. I can tell you it's not James, okay? But you can imagine how frustrated he was. Then it will heal up, and then it would come back. And he went to the dermatologist. They would give him antibiotics to try to clear this up. And from a dental point of view, you look at it and you see nothing there. But that's where you need to become a detective. Because he also had a little swelling under his tongue right behind where that little infection was. So we decided to take a CAT scan of it. And if you can read a CAT scan, you can notice right over here, he had an extra tooth. So for years, and finally, he had this extra tooth that was causing the drainage and the pus. And I don't bring it up to show you that this technology is great with the CAT scan. It is. But it shows you have to always be asking the question, what's causing this? There's a reason behind every problem, and we need to be detectives. We need to find the dysfunction that's causing our patients problems. Tomography is another way. It's an early detector of inflammation and disease processes in the body and stagnation. So if you would go to a parasite doctor and they'd say, oh, I found an amoeba, it would look something like this, okay? It's only a half-hour slide video. So. Okay, and what's around it is all these little spirochetes. Now, if you hear spirochetes, you think Lyme disease, right? So this is just a whole bunch of spirochetes gone crazy, okay? Now, this wasn't in a stool sample. This was in someone's mouth. So this is what you would need to do to be a detective, because if someone has this, you need to identify it. And every time I find a person who has an amoeba in the mouth, 100% of the time they've got parasites in the gut. Why? Because the gut and the mouth are attached, and it needs to be addressed. So when you treat a patient like this, right, everyone's treating the gut because they have parasites. You need to look to see in the mouth what they have. In the same way, the dentists who identify these pathogens, they need to send to the doctor to do a stool sample and find out how to clean the entire system and how to then boost the immune system so that the body can deal with this type of pathogen. So one technique that we use to be detective, we use the microscope. It's very quick. It's equivalent to your quick strep test. And you can see quickly what's going on with the patient. And that's where those samples came from. Just looking in the patient's mouth, you do a little quick swab under the gums and you can find out what's going on. I bring this slide up also because it's more teeth, but also because if you look at this patient and you understand her gums, they're swollen like balloons, okay? And they wanted to extract her teeth. And when I saw her, I was so excited. I'm like, I got my microscope, and I'm going to find bacteria, but there was nothing. Because what we discovered from being a detective and learning about dysfunction was she had nutritional problems. You know, she wasn't getting enough protein or she wasn't absorbing protein. So we bridged that gap between dentistry and medicine, and we sent her to the nutritionist. They did a workup, and they got her on a good source of protein and other nutrients so that she can then save her teeth and be healthier, not just in her mouth, but her whole body. So when you're looking at your patients, they don't have to look like this, and you say, okay, now I know you have a problem. They can look like this also, because these bugs are hiding, and it takes certain tools to find them. Okay? One tool is a test called oral DNA. It is a spit test, and you just look at, you just spit into a tube, and it gives you the pathogens that are associated with gum disease and the other oral systemic problems. So if you have a patient who has cardiovascular markers, and you can't understand why they have these markers for cardiovascular disease, this is a test you can do on your patients. Okay? Some of those bacteria that are considered the most aggressive, I'm not going to say this first word. We're just going to call it AA, okay? But you'll find that most of gum disease is transmissible through kissing, sharing utensils, okay? That bug is tissue invasive. It creates a toxin called leukotoxin that damages cell walls. It also produces nitric oxide to keep itself viable, and it helps it to actually increase and make more inflammation. Fusobacterium nucleatum is very smart. What it does is it punches holes in the epithelial lining so that it can then become invasive, but then all the other bacteria and viruses and fungus associated with it can also come in and create havoc in the rest of the body. And then you have that other bacteria, Porphyromonas gingivalis, which is also transmissible and invasive. And we discussed that earlier. And we can also do with salivary diagnostics, we can do genetic testing. Because how do you determine if a person is genetically marked to have a disease or if it's nutrition? So it helps guide the doctor as to what direction they should go in. Basically, dentistry can help save patients' lives. We can improve upon the endothelium by cleaning the infection up in the mouth. Okay? But here's the key. Okay? We know that the bacteria is associated with heart attacks, but we know also that we need to have an integrated approach bridging the gap between medicine and dentistry. I'm assuming everyone's gone to the dentist and they've had scaling and root planing, right? This is the old way, because the bugs have gotten so intelligent, or we've gotten so intelligent, we now know that when you put these devices to clean the teeth, the bugs scatter. They hide back in the tissue, they hide back in the teeth, and then 6 weeks later, when the coast is clear, they come back and they start their process of inflammation all over again. So the new way would be, for instance, using lasers. Lasers will decontaminate the tissue, but it will not cut away the tissue. And it's an effective way of dealing with these microbes. Other ways that are effective would actually be systemic antibiotics, but as we discussed earlier, I'm not a big fan of systemic antibiotics. So you can use systemic herbals also to deal with these microbes. A talk by myself is never complete unless I discuss floss, because I'm a dentist. How many bacteria do you think you can kill with a piece of string? Okay. The reality is, unless you have food caught in your teeth, flossing is a waste of time. It does nothing to treat gum disease. Okay? Okay, we can move on? Okay. Okay. And in conclusion, the microbiome is not about holistic dentistry or functional medicine. It's about the science and the medicine. Part of the Hippocratic Oath says, I will not be ashamed to say, I know not, nor will I fail to call in my colleagues when the skills of another are needed for a patient's recovery. It is now time to bridge the gap between dentistry and medicine to better serve our patients. Thank you very much.
Woo! Thanks so much for watching, and for more great clips like this, please subscribe to our YouTube channel. I've created a special free video just for you called Harnessing the Power of Community in Your Practice, and it'll give you a clinical model, practical tools that double as marketing, and strategies to develop a community of your peers. All you have to do is click on the link below.